Good afternoon, everybody, and welcome to the Health Trust's 25th anniversary virtual celebration. We are here today to celebrate the Health Trust work building health equity in Silicon Valley over the past 25 years and to recognize and support the critical services this organization provides to low-income seniors, people living with chronic health conditions, and individuals and families who are experiencing homelessness or recently housed in our community. I'm Damian Trujillo. I'm a news reporter at NBC Bay Area and Telemundo, Canal 48. This is my 25th year also. So we're all celebrating a silver anniversary, 25 years at NBC Bay Area. And I thank you for allowing me into your homes for the nightly newscasts on NBC Bay Area. Now we weren't expecting to have to celebrate this milestone year virtually, but what matters most is that we're here celebrating together, even if we're not all in the same room. We can, however, all be together in this live YouTube chat. So give a warm hello to your fellow attendees, say thanks to all the Health Trust staff, grab a coffee or some tea, grab a snack, And let's get settled in for this silver anniversary celebration. Now, when moving to a virtual setting, we have been able to make lemons and make lemonade out of those lemons. We're delighted to be able to welcome so many new friends to the Health Trust family without the confines of walls and seating capacities. So, thank you all for being here on this Wednesday afternoon. This afternoon, we will learn about the Health Trust's history and what they are doing on their mission to build health equity in Silicon Valley and beyond. Now, as a funder, provider, and advocate, the Health Trust is a unique partner in our community, and their impact is felt widely. This year alone, they are providing almost $20 million in community benefit, a truly astounding feat during this pandemic. And now, to help us celebrate, I'd like to invite the Health Trust Board Chair, David Neighbors, to join me on the screen for this special occasion. David.
Good to see you, Damian. Thank you for joining us. I have the honor of serving my third term as board chair of this incredible organization. As a lifelong East San Josean, the belief that everyone in our community should have the opportunity to be healthy is something that speaks to my heart. A person's race, immigration status, or zip code should not be a barrier to one's health. We need longer tables, not higher walls, to effectively make a difference for those in need. To get our program started, please help me in thanking our top supporters for today's event. Our Wellness Warrior sponsors, Blue Shield of California, Google, SEI, Silicon Valley Community Foundation, and Stanford Healthcare. And our Wellness Hero sponsors, Janice and Thomas Berthold, and Physicians Medical Group of San Jose. You can see a complete list of all of our sponsors on our event page. We're beyond grateful for their generosity. Thank you to each one of you who makes our work possible with your incredible contributions of time, talent, and treasure. Let us take a moment to thank our elected official partners who have supported the Health Trust through the years. There are too many to name, but we acknowledge Senator Dave Cortese for presenting the Health Trust with a resolution from the State Senate and our regional delegation, and council members Deb Davis and Madalena Carrasco for their commendations on behalf of the City of San Jose. Thank you for your work and these special recognitions.
Thank you, David. Now, for those of us who are beginning now, just starting to get to know the Health Trust, why don't you give us a 411?
It would be my pleasure, Damien. The Health Trust is what is known as a hospital or healthcare conversion foundation. We were formed in 1996 from the sale of a local nonprofit hospital system to a for-profit corporation. The proceeds from that sale created a community benefit foundation, which then evolved with the help of many dedicated community members into the organization we know and love today. Since its creation, the Health Trust has served Silicon Valley not only as a grant-making foundation, but as a service provider and an advocate. For 25 years, we have ensured that health-related grants, policies, and services exist to give everyone in Silicon Valley the opportunity to be healthy. That is what building health equity means to us. We're a mission-driven organization by our core values, one that we try to achieve through every role we play in the community. But do not just take my word for it. Let us watch this special video together, reflecting on what we have been doing for the last 25 years. Immediately following the video, we will hear from our leader, Michelle Liu. Michelle joined the Health Trust as our CEO in 2018, and she provides leadership for all of our organization's operations and resources.
The Health Trust was created because Columbia purchased the Good Samaritan Health System, and because Columbia was a for-profit entity and the Good Samaritan Health System was a not-for-profit, they had to figure out then what to do with the revenue coming out of that sale. And the board at the time, the hospital board that is, said, well, we're not really good at figuring out what to do with $56 million in the community. Why don't we create a task force or a community task force, whatever term they used at the time, to figure that out? We just started reaching out to people in the community. They were senior people, so it could have been like a Larry Jenks at the Business Journal, or it was Eric Brandenburg, Brad Barron, some of these names, Peter Henke, Susan Hammer's budget director, I always remember, Bob Brownstein. But anyway, the point of it was they were just these people that we just sensed could make a difference, but we didn't know how it was all going to work out.
The Health Trust started 25 years ago with legacy programs from the old nonprofit Good Samaritan hospital system. And over the decades, we have grown based on what the community needed. So while we started with Meals on Wheels and case management services for people with HIV/AIDS, we have grown to include programs that focus on early childhood education, dental care, and water fluoridation. We have gotten into homelessness prevention and housing support services.
I think being a provider, a funder, and an advocate, it really makes the Health Trust unique in the nonprofit world. The first time I understood that concept was when Michelle Liu, our CEO, came on board and she discussed it, and it's one of those things kind of along with health equity. When you first hear it, I mean, ultimately it means that when it comes to health and closing the equity gap that we have here in this valley, it's not that you give every single person a loaf of bread. You give them what they need to help them survive.
The Health Trust has been a partner with Somos Mayfair for many, many years. We've had grants for policy work, for incubation through disruptive innovation grants, and also most recently for the Si Se Puede Collective, supporting the entire neighborhood through the pandemic. This last year has been incredibly hard for so many people, and the Si Se Puede Collective was formed several years ago, 5 organizations in East San Jose. And I think in the pandemic, we really had an opportunity to look at all of our services and the ways we can impact residents, including families. And I think the partnership with the Health Trust allowed us to really build out our infrastructure so that we could center the needs of families in all the work that we're doing.
Living here in Silicon Valley and the challenges that each of us face, whether it's food insecurity, whether it's housing insecurity, and we could just throw up our hands and say, that's a big problem and there's no way that we're going to tackle it. But at the Health Trust, the team here, you all are doing things that are changing one life at a time. So you're making a difference. Are we going to solve all the world's problems in the foreseeable future? We may not, but we're changing lives here in Silicon Valley.
Thanks to the foundation and the legacy that our predecessors have built for the Health Trust, the future of the Health Trust is bright. I think we have seen during this pandemic that the work of the Health Trust is needed now, perhaps more than ever. We can no longer ignore racial health disparities right here in our backyard in Silicon Valley. And with the Health Trust work as a funder, provider, and advocate, we can work in partnership with other community initiatives and really move the needle on building health equity.
The greatest accomplishment is the fact that we're here talking about it. And it tells me that for the people that were a part of this in the early days, and then as you look at any kind of organizational structure, people pass the baton to the next generation of leadership, which we've had over the 25 years. And the fact that we can sit here and look back over the 25 years and still see the fruits of our work 25 years later with really skilled people is one of the best things that I would say excites me. So whatever's been modeled over these 25 years that got us to where we are today, I'd love to see it being modeled again over the next 25 years.
Hi, everyone. I'm Michelle Liu, CEO of the Health Trust. Thank you so much for joining us this afternoon. I'm delighted to be celebrating the Health Trust's 25th anniversary with so many friends and partners. We're here today because of amazing, resilient people who make this work worthwhile. People like Andrea, who you'll meet a little later in our program. People like Gary, who was gravely ill and living in his car until he got connected with one of our housing case managers. And people like Peggy, a homebound senior eating only one meal a day until she started receiving nutritious meals from our Meals on Wheels program. For 25 years, the Health Trust has been committed to leveraging our powers as a grant maker, as a direct service provider, and as an advocate to make Silicon Valley a healthier community and uplift clients like Andrea, Gary, and Peggy. The pandemic has tested us and called us to serve more in the last 18 months than ever before. I'm so proud of the Health Trust response to ensure continued support for our communities most in need. Sure, there were tough days, like when we lost more than half of our volunteer Meals on Wheels drivers overnight, but we faced those challenges head on, bringing all hands on deck to ensure our clients, especially older adults and homebound residents across the county, received the support they needed to remain safe and healthy at home. Today, I join you, albeit virtually, immensely honored to follow in the footsteps of prior CEOs Gary Allen and Fred Ferrer, as well as interim leaders Todd Hansen and Charlie Bullock. And I'm honored to stand alongside so many past and present staff, trustees, and volunteers, everyday heroes who give of themselves in support of community. It's because of your foundation and steadfast dedication to our mission that we've accomplished so much together. As we look to the next 25 years, we want to build a community where everyone has the opportunity to be healthy. A community where someone's health is not determined by their zip code, their last name, or the color of their skin. We hope you'll join us in these efforts. In the next several years, we'll be guided by our new strategic plan and our focus on improving health through food, making chronic diseases more preventable and manageable, and prioritizing health in housing. We want to reduce food insecurity and ensure residents get healthy, nutritious food. We want to expand case management services for people living with HIV/AIDS in order to get to 0 new HIV infections and 0 deaths related to AIDS. We want to turn the tide on chronic diseases like diabetes, tackling both prevention and chronic disease management. And we want to help people who are homeless get housed and then support them in pursuing better mental health, physical health, and well-being. As we move forward, we also seek to be more intentional about addressing health and racial equity in our work within the community and within our organization. We know our clients don't just rely on us to deliver meals and essential support services. They also want us to help lift up their voices and collaborate in new ways. That's why we're investing in an ecosystem focused on building health equity by supporting partner organizations working directly with those impacted by COVID-19 and advocating for policies that make all our communities healthier. But we can't do this alone. That's why we're so grateful that you're with us today. Clients, grantees, community partners, funders, policymakers, public and private sector leaders, thank you. Together, we can build health equity.
Thank you, Michelle, for your passionate leadership.
You know, what's interesting, David, just watching those videos is those of us who are fortunate enough to be covered by your company's, your employer's health insurance, we kind of take for granted, we assume that everyone has the same benefits, and you forget that there's just so many in our own neighborhoods who are suffering from health inequity.
That's true. You know, I've watched this video for the first time right now, that the finished product, and a couple things that really struck me is I have the honor of serving with Camille Yana Spontanea, and Camille's a fellow East Sider, and we're tasked with, you know, it's not enough to be successful. You need to give back. You need to reach out and you need to help others. And at the same time, seeing Dave Henderson, his vision as a founding board member, is the original board chair of this organization. And now I have the pleasure of serving with Dave's son, Greg. And I look at them and it reminds me that to bridge these equity gaps, it's going to take those who have not necessarily been directly affected by inequities to care as much and be as outraged in these gaps that we see as those who have been directly impacted, to really find true solutions. You
know, I've known you for more than those 25 years, David, and I'm not surprised that You're taking the leadership role on such an important community issue such as this one. So congratulations to you.
Thank you, Damien. You know, it actually goes back to not long after we met at San Jose State's Chicano commencement in 1993, and our keynote speaker saying, okay, congratulations to all of you, but now you need to get to work. You need to do something for your little brothers, your little sisters. And I'm the youngest, I'm the baby of my family. But he was quick to say, if you don't have little brothers and little sisters, it's the community at large. And I took that as a call to action, Damien, and I've been involved ever since. And what you have done with your involvement and the 25 years at Comunidad del Valle, you know, I watch it regularly, and you're making just such a huge difference, not only in the material that you're providing, but you being on the screen. It inspires the next Damien Trujillo to go on and live their dream.
That's very kind words. I appreciate that, David. You know, we're in it for the community, and so no rest for the weary here. I'll let you take over the rest of the remainder of this part of the program, David.
While we're here to celebrate and reflect on the impact of this great organization, we're also here to support their work. Know that if at any time you're inspired by our stories to donate, you can easily do that right on your mobile telephone. Now grab your phone. I know it's sitting right next to you on your couch or your desk. Here are the instructions. We will return with these later in the program as well. You may make your gift by sending a text message to 41444. In the message, type health 25 space amount space your name and send, and then click on the link in the reply to process your payment, or email us at events@healthtrust.org if you prefer to send a check, use your donor advised fund, or if you want information about employee match programs.
All right, thank you for those instructions, David. Now, as Michelle mentioned, this past year and a half have been extraordinarily challenging for our global and local communities and for organizations like the Health Trust, supporting those most in need. Now, for many, including the most Health Trust clients, COVID-19 made already difficult situations even worse. The organization saw demand for home-delivered meals skyrocket as more vulnerable individuals were forced to self-isolate. Low-income people of color and those experiencing homelessness face disproportionate risk of illness and death. And clients who rely heavily on support to manage their health could no longer access their doctors as easily as they could before. Yet through the challenges, staff dug deep, knowing that clients needed them more than ever. And in those moments of chaos, clients were the North Star and the shining light for their work. We want to meet Andrea. She's a client of the Health Trust who, even when faced with heartbreak and tragedy, Andrea has taught us an invaluable lesson in love and resilience.
My name is Andrea Renee Hendricks Cannon. I've been a client of the Health Trust going on 6 years. The nurse, Paul Williams, he moved out here to this new job. It was a new job to him. So he was telling me how good it is. And that's how I found out about this, Health Trust. And then I moved out here. Then I started going to the Health Trust. Everything they have, I'm a part of it. The health group, the support groups, counseling, the food basket, the dietitian, 580. I'm 267 now. A lot of weight. Christina Cox, she's the greatest. At first, when I first met her, we couldn't get along, but me and her sit down and we start talking. We find out we are one of the best, a good team. She calls the Medicare. Medical transportation, hooked me up with the on-site dental. She helped me with my eyes, to go get my eyes to start getting checked out because I got glaucoma. and I have to have the medicine. When I first found out I had HIV, I wanted to go stand in front of a truck and let that truck hit me. Well, when I was first started, I was on 14 pills in the morning, 14 pills at night. Now, I'm only on 2 pills in the daytime. When the pandemic started, I was very upset because I couldn't go outside to go see my doctors. I love all my doctors. I love going to the doctors. My daughter, she passed away on last year, December the 21st, she died. That's my daughter said, I can't breathe. My daughter, she just passed away. All that stuff I've been through, I done let depression get me down. I was okay. I've been making a bunch of blankets for the homeless people. Different colors, like these, for the homeless people. And every year it adds up to 100 blankets. And we give them out in November of each year. And I make these, my diamond paintings. Just to put a smile on other people's faces. I have to live. I have to survive. I have to move on. If you hold on to the past, you'll never make room for the future. All I can say to everyone out there, please give Health Trust a try. You cannot go wrong.
Boy, what a beautiful soul that Andrea is, David. You know, it reminds me what sometimes when I speak to college students, and you mentioned that this is the time to roll up your sleeves. I always remind them or tell them the story of my upbringing. Is that when things got down and out and things were really tough, and I wasn't sure if I was going to make it even through college. That reminded me of this one song. It's by a Mexican singer named Vicente Fernandez. And the song is called No Me sé rajar, and it means I don't know how to quit. And Andrea personifies that. It's the idea that you don't know the meaning of the term quitting when everything's thrown against you and you feel like you're that this is it. No, you think of that song No Me sé rajar, and no, you can't learn how to quit. And she exemplifies that to the T.
Completely agree, Damien. And to see someone who is at a point where there's no hope, and the connection with the Health Trust gives her hope, but then she goes out and she serves others. And I've seen, you know, and you live by that. I've seen you do that with your lovely wife, Monica, bringing food out to the campesinos. And I just, you know, it's another thing that I admire about you, Damien.
Thank you. I appreciate that. You know, David, I'm sure that you and everybody else at the Health Trust, when you go to bed at night, your head falls comfortably on the pillow, and you're going to sleep well because you're knowing that you're doing a good thing. You're fighting the good fight.
Thank you, Damien. I mean, seeing clients that the Health Trust serves, it's such an important reminder about the impact of our organization and what our Health Trust family does to serve our community. This afternoon, we have heard about the Health Trust's dynamic contributions as a local funder, provider, and advocate. And we are looking for your support. We know you may have already donated to the anniversary celebration, and for that, we are extremely grateful. But if you have not donated already, or if you've been moved by the work we are doing, we encourage you to pull out your telephone right now. And we are excited to announce that everything raised this afternoon will be matched by the generous support of the Sobrato Family Foundation's $125,000 matching grant. Every dollar donated this afternoon will result in $2 toward the Health Trust's mission of building health equity. Damien, would you please share those instructions again?
I will. And just something on the Sobratos. I had John Sobrato, a senior, on my show a few years ago, and you talk about the epitome of philanthropy. Here's a gentleman and a foundation who give to the most needy, and those are on the east side, and wherever the need is great. That's where the Sobrato Foundation invests their money, and I do say invest because they don't give it away; they invest it in them. So yes, so you can text the given instructions. Text 41444. You text that in the message part of your text, and then you type health 25. That's HEALTH 25 space, and the amount that you'd like to contribute, and then your name, and then you hit send. And then click on the link in the reply text that you received to process that payment for the Health Trust. If you would like to send a check, make a gift using your donor advised fund, or if you want to take advantage of an employer match program, send an email to events@healthtrust.org, and they'll help make that happen for you.
Thank you, Damien. That's an important reminder about what John Sobrato Sr. and his entire family has done for our community. I had the privilege of serving on the National Hispanic University Board of Trustees with John, and it took me a while to not call him Mr. Sobrato. He kept having to remind me just to call him John, but I learned so much and just soaked up so much information sitting across the board table from him. This afternoon, our goal is to raise $50,000 of additional donations. I know we can do it together because of each of you, because like you, like me, we believe in the work of the Health Trust. So far, through the commitment of our sponsors and early supporters, we have already raised $170,000. Is that not incredible? Your donations today allow us to keep the mission of health equity moving, giving us the resources to do more for our neighbors who are the most in need. A donation of $5,000 can provide 25 hours of intensive case management for a newly housed client who is settling in and learning to be self-sufficient. A client like Rodrigo, who was so thankful to our staff for helping him find a home and improve his quality of life after a long period of being in sheltered. Rodrigo is now able to continue school and work, which is extremely important to him, so he can achieve his goals. $2,500 will provide 24 hours of case management services for a client who has learned they are HIV positive and needs help managing their condition. Just like with Andrea, our case managers support clients living with HIV/AIDS to live life to the fullest, whether it is accompanying them to doctor's appointments, setting them up with transportation, or connecting them to community resources. Our case managers are there so that they do not have to do it alone. Remember, this is our 25th anniversary year, and if you have capacity to stretch to this giving level, it would be such a special way to commemorate this milestone. We have confirmation of a gift coming in at $2,500 from my fellow board member and Legacy Health Trust hero, Greg Henderson. Yes, Dave Henderson's son. Thank you, Greg, for your continued support. The instructions are here on the screen again for everyone. Send a text message to 41444. In the message, type health 25, space, amount, space, your name, hit send, and then click on the link in the reply text you received to process your payment.
And just look at those donors: Laura Schultz, Dina Dickinson, We have an anonymous donor as well. You mentioned Greg Henderson, Emily Lamb, Christine Tomkala, Margot Seidner, also Kathleen Alongi, many donors who have stepped up and contributed to this great cause by this great organization. So let me, with those numbers, let me put those amounts in context. In the Health Trust work with residents living with HIV/AIDS, 94% of clients have remained virally suppressed, meaning once almost always fatal infection can be treated as a manageable chronic condition. This last year, the Health Trust served more than 750 individuals with housing case management services, preventing evictions and helping people find stable housing. From March 2020 to March 2021, the Health Trust served more than 360,000 meals, more than doubling their pre-pandemic client number and increasing meals by over 600% at their peak. Now, to date, more than 2.7 million meals have been delivered through the Health Trust Meals on Wheels program. Give them a round of applause for that. 90% of Health Trust clients reported feeling more socially connected and less lonely as a result of participating in Friends from Meals on Wheels, a friendly visitor program for homebound seniors. And David, now tell us how donations can help improve health through food.
Well, Damien, a donation of $1,000 can provide 46 medically tailored meals for a client recently released from the hospital who needs help managing a chronic health condition like diabetes or congestive heart failure. $500 can provide over 50 nutritious meals and wellness checks for a homebound senior or older disabled neighbor. I love the letter one of our Meals on Wheels clients wrote, praising his Meals on Wheels driver, Adela. You know, for many of our Meals on Wheels clients, their delivery drivers are often the only social interaction they have in days, sometimes even weeks. This client wrote, I'm an 85-year-old disabled veteran and writer, reliant upon a wheelchair, and continually amazed at the kindness and high spirits of Adela, as well as by the superior quality of Meals on Wheels.
Oh, that is great. And the donors, I'm told, keep coming in. The thermometer keeps rising, indicating the level of donations that keep coming in. There it is right there, up to $14,328, I'm told. And again, the names are popping up on the screen of the donors. We've mentioned some of those already. So thank you all so much for that contribution and making these stories, these life stories that we're hearing about here, helping those families succeed in this economy. A reminder about the match: every dollar raised this afternoon will be matched by the Sobrato Family Foundation's $125,000 matching grant. So double your contribution towards the work of the Health Trust. David, tell me a little bit more about some of the clients you've learned about as board chair for the past several years.
It's my pleasure, Damien. It's one of the things that I enjoy most is getting to meet our clients. A gentleman who was instrumental in my serving in elected office has visited our Jerry Larson food basket, and he always thanks me for the difference the Health Trust has made in his life. This is a man who spent a career as an educator, and I think it's just a sign of the times and the valley in which we live that there are folks in need here, and to know that the Health Trust is making a difference, like you said, Damien, it does help me sleep at night. A client of ours, Bob, who's a fan of karaoke, lost his vision from severe glaucoma and has struggled with being homebound. His friendly visitors from our Friends from Meals on Wheels program help him feel less lonely. They provided him with an Alexa device so he can easily listen to music by voice command. When they visit, he regales them by singing some of his favorite Frank Sinatra songs. Say, Damien, what's your go-to karaoke song?
Oh, always. It's the Charlie Daniels Band, The Devil Went Down to Georgia. That's number one on my list.
Oh, man. You know, I can picture you right now in your cowboy hat singing that. So we're going to have to get together, and I have to witness this performance.
Anytime, buddy.
We regularly hear from clients and their family members comments as, you guys are lifesavers. This service has truly been life-changing. One of my favorite comments I heard from a medically tailored meals client was, you really saved my bacon. She meant this figuratively and not literally, since bacon doesn't make its way into our medically tailored meals. But our meals helped her stay alive.
Oh, that's wonderful. And remember, the Health Trust doesn't do great community work alone. A big part of their impact is being able to support partner organizations through its philanthropic foundation and collaborating to create systemic change to some of our most pressing health challenges. Each year, the Health Trust invests $2.2 million from its endowment to nonprofit and public agencies that support the health and well-being of residents in Santa Clara and northern San Benito counties. Now, for the past 2 years, it has increased grant making by almost 50% through a COVID-19 recovery fund established to prioritize communities disproportionately impacted by this pandemic and to help address the health disparities laid bare by it. The Health Trust also has a track record of advocating for policies that make all our communities healthier, such as fighting for fluoridation of our city's water supply to reduce tooth decay in children and in adults, as well as greater health screenings for diseases that disproportionately affect people of color. Now, most recently, the Health Trust has led state and local advocacy efforts pertaining to insulin affordability, food security, affordable housing, and health disparities exacerbated by the COVID-19 pandemic. And we are excited to share that on Monday, this past Monday, Governor Newsom signed AB 789 into law. This bill, co-sponsored by the Health Trust, is making California the first state in the country to provide adults voluntary screenings for hepatitis B and C in an effort to save countless lives and close disparities in diagnosis and treatment in AAPI and in Black communities. Now, if the donations are coming in, we'll put the thermometer back up and read those names for you. Let's see if we have any other names that are popping up. Let's see, there's Margaret Seidner again, Kathleen Alongi. So those names will keep popping up as more donors come in. We're up to $32,000 though, David. That's close to the $50,000 goal. And even in this pandemic, I'm not surprised at the generosity of this great public. We've received so many commitments, David, and I'm awestruck by this community's commitment to building health equity for all.
Absolutely, Damien. This community means so much to me personally. Thank you for having me join you this afternoon. You know, if you ever need a co-host on your show, you know my number. I'm sure I'm available.
Oh, you're after my job, but hey, you might be able to take it another 25 years if the Lord gives me that much time.
Let's take a moment to hear from some of our longtime supporters and staff about what the Health Trust's 25 years of commitment means to them.
You know, as I get older, I find it's a rare opportunity to be invited to a 25th birthday celebration. Happy 25th to all of our partners and friends who are part of the Health Trust Network. We are so grateful for the quarter century of service that the Health Trust has provided to Santa Clara County. Because of your leadership and your work, more than $3 million have been distributed to a network of nonprofits here this year alone in this most critical of years amid the pandemic. The Health Trust has been an essential partner of ours in the distribution of millions of meals over the last several months. You have been a great thought partner and leader in health equity in our community. Thank you for all that you have done. To Michelle Liu and the entire team, happy 25th.
Health Trust, you have been a great organization to work with. Your impact has been tremendous. You have served those most in need in many areas: HIV, chronic disease management, housing. And now you've become a leader in health policies that are going to stay with us for a long time and serve all of County of Santa Clara. So for that, we thank you, we congratulate you. Michelle Liu, Board of Directors and staff. Sandur.
I'm grateful for the tremendous work that the Health Trust has done, especially when it came to quickly responding to the COVID-19 pandemic by ensuring our residents have access to food and resources to remain safe and healthy. During times of need, the Health Trust has proven itself for the past 25 years as a vital part of our county in providing critical services and supporting policies that make our community healthier. Thank you so much for everything you do.
Hi, I'm Alma Burrell with Roots Community Health Center, and I'm happy to participate with the Health Trust and all of your staff and stakeholders celebrating 25 years of awesome service in Santa Clara County. So cheers to all of the Health Trust staff and everyone that has made the Health Trust what it is today and contributed to the work that we've done in Santa Clara County.
I'm here in celebration.
I am here in celebration.
I'm here in celebration of the work of the Health Trust.
Of all of the work the Health Trust has done.
Over the last 25 years.
For the last 25 years.
For building a community where each and everyone's health matters.
Thank you to the Health Trust.
Thank you all, and be blessed.
Congratulations on 25 happy years.
I just really want to say happy 25th anniversary.
Happy 25th anniversary.
Happy anniversary, Health Trust.
Happy 25th anniversary.
Happy 25th anniversary.
Happy 25th anniversary.
Happy 25th anniversary to the Health Trust.
Happy 25th anniversary to the Health Trust. Saludos.
Cheers.
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 If I may, a special shout out to Dave and Noelle Henderson for a $10,000 contribution. You've heard me mention Dave as being one of the founders and original board members, the original board chair of this organization. So he and Noelle, they've been with us since the beginning, and their continued support really means a lot. We want everyone to know you can keep giving and know that the Health Trust is here because of your generous support.
And generosity has been the key word today by this entire community. Thank you again for joining us this afternoon, and know that the Health Trust will be continuing their focus on improving health through food, making chronic conditions more preventable and manageable, and prioritizing health in housing. We all share the vision and passion for a healthier Silicon Valley for everyone. Thank you all so much. And David, thank you again for being my co-host here, and cheers. Happy 25 years. Salud.
Hey, salud, Damien, and felicidades to the Health Trust for 25 years.
Thank you, everybody.